Okay, let's begin our class. Pharmacology is very important subject for you to be a doctor. For every department in hospital, you should use drug. Even you will know to be a doctor, knowing some knowledge about drug is also useful. Before we begin to study the definite drug, we should know some terms in advance, or you will not understand what the later chapter talking about. For instance, let's read this passage. It's about the pharmacokinetics of verapamil, which is a very important drug for antihypertension and other cardiovascular disease. We will discuss it in a later chapter. Verapamil, pharmacokinetics. The half-life of verapamil is approximately 7 hours. It's extensively metabolized by the liver. After oral administration, its bioavailability is only about 20%. Therefore, verapamil must be administered with caution in patients with hepatic dysfunction. Effective oral doses are higher than the intravenous doses because of first-pass metabolism and range from 120 mg to 640 mg daily, divided into 3 or 4 doses. Pay attention to the data in red: half-life, bioavailability, first-pass metabolism. We couldn't understand it so well before we knowing the meaning of this term exactly. So, before we learn the definite drug, let's begin from general principle. General principle. First, we should learn some history of pharmacology. The history of pharmacology is easier to understand. You could read it by yourself. Here, I will tell you an interesting story. When I traveled to Kenya, I spent almost 1 month in this country. I visited 5 national parks and joined safari. I also have been to the beach city Mombasa. There, I visited a blind school. The children there were very interested about traditional Chinese medicine and Chinese martial art. They asked me what kind of material could be used as a medicine. In fact, the plant, animal, and mineral, all kinds of substance could be used as a medicine. For example, garlic. Garlic has an antibacterial function. Antimicinin. Antimicinin could have used to treat malaria. Yu Tu is a professor in Academy of Chinese Medical Science who received the Nobel Prize in 2015 to find artemisinin to have anti-malaria function. Another example, donkey hide gelatin. Donkey hide gelatin in China could use to treat anemia and stop breathing. Lime. Lime could use to treat the wound by life by relieving pain and stopping breathing. 2 pharmaceutical masterpieces in Chinese history. You come to China to study medicine, so I will mention you 2 pharmaceutical masterpieces in Chinese history. One is Shen Long Ben Chao Jing in Chinese. Shen Long's herbal classic in English. It's not real name of Shen Long, it's a collection. It's the earliest extant traditional Chinese medicine book written before Han Dynasty. It is a collection of medical scientists. The other is Ben Chao Gan Mu in Chinese, Companion of Material Medical in English. It's written by Li Shizhen. Li Shizhen was the originator of Chinese pharmacology. His book is masterpiece in Chinese pharmacohistory.